Yes, please start. Hazima, you can start now.
Okay. Bismillahirrahmanirrahim. Assalamu alaikum and good day, ladies and gentlemen. I'm Hazima Mozam and I welcome you to another exciting lecture under Comstech Distinguished Scholars webinar series. We are very delighted and honored to have Professor Dr. Mobashir Bhatti with us today for his lecture on South Asia's healthcare challenges. To introduce him briefly, Dr. Mobashir Bhatti is an MBBS, MD, Naturopath, and Nutritionist, and he's also Honorary Consul of Papua, New Guinea in Pakistan. And with this, I would request Dr. Hina, who's my colleague at ICCBS, to please introduce our guest speaker for today and to invite him formally. Over to you, Dr. Hina.
Mobashir Bhatti for joining us. It is such a pleasure and honor for us. And it's my pleasure to introduce all of you with Dr. Bhatti. Dr. Bhatti is a medical doctor who devoted his efforts to the need of forming an international team of professionals to work as a research and development group in compiling evidence-based empirical data that establish the document's global health issue. To encounter the health crisis in third world countries with a focus to heal humanity through integrative medical solutions. Dr. Bhatti is a neuropath MD. He is certified nutritional consultant and MBA also. Dr. Bhatti is the founding president of Pakistan Association Integrative Medicine and executive coaching lead for the South Asian Academy of Physician and Surgeon. He has worked in over a dozen of countries, setting up leadership, product research, and alliance teams. As a leader and team developer expert, now he is focused especially on healthcare sector. With this introduction, I would like to invite Dr. Bhatti for his exciting lecture. Sir.
Yeah, thank you very much. So let's we can start. Bismillahirrahmanirrahim. Today, basically, the current issue in pandemic in the South Asia and the Muslim country, the Muslim world as a whole. So my focus today to have the target population of South Asia, which basically has a lot of health challenges now and the near future. So the South Asian health, in my opinion, basically is the Muslim health. The reason behind, more than 600 million Muslims are living in South Asia. Out of the whole world, it's about 1/4 population across the globe is Muslim. About close to 2 billion people across the globe, the Muslims are. And out of that, more than 600 million Muslims are in South Asia, who are contributing to the health of most of the Muslim countries. South Asia, like the workers working in Middle East, I think there are more than 50% workers that belong to the South Asia. So the South Asian health in communicable diseases and non-communicable diseases, a lot of impact in this region, including the Middle East. So the countries like in Bangladesh, Bhutan, India, Pakistan, Nepal, Sri Lanka, Afghanistan, and Maldives, out of all these countries, the 2% of its GDP is only spending on the healthcare, lagging any other region. So we are really deprived to serve our nations in this region when we talk about the health sector. So the health expenditure, they are so inappropriate. The future challenge have a lot of challenge to this region, specifically where we are claiming the Muslim world has a lot of strength to serve us. So the pillars of the health, when we're talking about in any region, to make this country more viable and a healthy country that should have proper healthcare education, healthcare professionals support, and the research sector, which we are lacking at this moment, and the infrastructure will still be in developed country were behind. So out of 5 people, 1 out of 5 in South Asia, by the year 2050, will be an older person, meaning that about 500 million Muslims, individuals, they will be the elder in the year 2050. Meaning by that, the elder people, when they are not properly healthy and they have extreme economic, socio-economic burden on the health sector across this South Asia. So at the same time, the early death rate and the illnesses from the non-communicable diseases and injuries increased between the 90 and 2010. In my opinion, still this figure is going on continuously in this sector. So the healthy years of the life lost from the ischemic heart disease, the coronary artery disease, has already extremely, bad impact, covering more than 73% population who are suffering from this, specifically heart disease sector. And cardiac diseases, right now, they are panic phenomena economically when we're talking about to symptomatic relief of the people in the South Asia. And the low back pains is not meaning the low back pain is a spine issue only. Is a lot of deficiency factors which leading to the low back pain, ultimately the distortion in the whole spine, creating a lot of other problems. It's covering more than 33%. And the diabetes, unfortunately, has 104% raise in these years, which is really challenging to the South Asian region. So now, when we're talking about we live long, if we live long healthy, it means we are supporting the nation. If we are live long and longer, and the illnesses carrying, it is extreme economic, socio-economic burden on the region. So in this socio-economic burden, our long life, which we are challenged, we say in the 2050, we have more than 500 million people elder. It means our load on the socio-economic sector will be extremely challenging, which can be threat to this region if we are not addressing right now. So the disease shift, now we can, moving from infection diseases to the non-infection diseases like lifestyle diseases, which has become nowadays epidemic and pandemic across the globe. So before that, there was only infectious disease, which basically creating a lot of burden to the economies. But nowadays, lifestyle diseases become the challenge to the whole globe, especially the developing countries like South Asian countries. So non-communicable disease, meaning by that having no infection, but this diseases is based on how we live, how our lifestyle is, how the government is supporting the region in lieu of their health education or the services at the grassroots level. So that lead to a chronic pattern. The chronic diseases now become the epidemic across the globe. That's the only reason the whole world is focusing on the lifestyle diseases. So this basically based on not only how we live, this basically affects a lot of our genetic patterns, our physiological patterns. So these lifestyle patterns also the one of the factor, environment factor, they're causing diseases. If we in our genetic and physiological pattern have no R&D and no sport across the, across the South Asia with a pattern having the empirical data, how these lifestyle factoring, they are disturbing the economic, socio-economic area. So this burden in South Asia of non-communicable diseases, specifically the 4 areas, in the cardiovascular diseases, diabetes, cancer, chronic obstructive pulmonary diseases, in South Asia is right now the challenge. This challenge creating a lot of burden and creating a lot of challenges in the health sector. So which shift factoring in the lifestyle in the South Asian region, creating a lot of dietary habits issues, the use of the tobacco and the high blood pressure, which we are not considering because of lacking in education and not the right food, not the right lifestyle. So improving the life expectancy, increasing the socio-economic development and urbanization in South Asia is expected to lead the further escalation of this kind of diseases in the near future. Specifically, the industrialization A lot of industrialization is going on, which is basically disturbing the environment and our lifestyle. At the same time, the westernization of the lifestyle, like the fast foods, like tame foods, they are creating a lot of lifestyle factoring with keeping the people not healthy. And this aging process will become a bad influence in the health sector. The shared ancestry of the South Asia. The problem is that we are not able to educate the people in the lifestyle, but the need is behind that at this point. At this point, a lot of genetic factors they are coordinating, and those genetic factors, I would like to give the example on that part. Our genomes and the whole exome sequence of the South Asian revealed there are 3 million new genetic variants which basically are available and has a lot of factoring in the lifestyle area. So one side is the challenge to us in the lifestyle, but the need is on the genetic system, the R&D chapter. So my humble request at this forum, I need professionals to focus on it. I need every country should have to put a share on the R&D so we can work on the factoring in the genetic sector. So the genetic, if they have a lot of variants, it means with a lot of challenge to focus and get a solution from these genetic oriented diseases. So the population-specific genetic variants, specifically contributing to different diseases, it is also a need of the day for the medical professionals and the health departments across South Asia. The first comprehensive map of genetic variation in South Asia shows a lot of evidence for selective pressures on the genes involving the skin biology, metabolism, infection, and immunity. So the factoring, which basically has a specific genetic variation, the contribution based on that is lack of knowledge. Lack of knowledge of the pattern of the genetic variations, specifically in South Asia, and the major limitation to identify the genetic variants which influencing the sustainability in the population. For example, the 25B deletion factor in the gene encoding the MYPBC3, it is present in about 4% population of the Indian subcontinent, but not present in the Europe. So to me, the diseases based of this 4% population across the Indian subcontinent, specifically in the heart diseases, can create 7 times more heart diseases. But unfortunately, to encounter these diseases or to have the solution of these diseases, symptomatic or non-symptomatic, we are using the medication and protocols based on the Europe and North America. While this factoring of gene depletion factor, 25pp depletion factor, covering more than 4% population of this region, is threats to this region, not of the right appropriate treatment of the patients. So it's not just for the patient, it's not just for the government money spending on the health sector, specifically heart diseases, which cover this 4% population of this region. So the regional specific area when we are talking about in the South Asia, there's 2 to 4 times high risk of the type 2 diabetes and cardiovascular disease compared to the European. It is a big threat because we are most populated countries in this region. Yeah, I think the major population is one portion in this specific area, India, Pakistan, Bangladesh. But unfortunately, our risk factor is 2 to 4 times, but our substrate and our sport is way less than the human country, which is not, I think, appropriate our efforts so far, which is required at this moment. So the individualized healthcare. What, being a professional, I was inspired from my early age when I was in the house job. I was feeling most of our patients, they are coming to us and we give them symptomatic relief to the patient. We never focused, what's going on across the region about specific genetic information, the research factors on how to address the disease and specifically the cause of the disease. I will give the example of the blood pressure. So blood pressure basically is not a disease, it's a symptom. So the pressure of the blood against the wall of the artery, when we specifically give, we have 3-4 options: ACE inhibitors, calcium channel blockers, diuretics, sport, angiotensin. These sports, basically, they are only organized across the globe, while the causes behind this factoring maybe as a regional, maybe as individual lifestyle based. The people living in certain areas where potassium level is deprived and nutrition level is not appropriate, maybe the blood pressure is only caused because that typical factor, or their endocrine function is not appropriate because they have not proper nutrition, or their environmental factors are so bad, that's the reason they are not appropriate in lieu of their recovery from the disease. So we are just symptomatic create the batch by recommending the medication which is based on the symptoms. So the knowledge of the patient in view of the genetic profiling from the doctor side and for the doctors have a lot of administrative mishandling at this point, which really need this region to be in concern. So personalized medicine is the most advanced pattern, which basically not only based on the lifestyle medication, but can go to the genetic levels also. So we need to create a center of excellence or a team of the professionals in South Asia who can comprise such kind of factoring to support this region. There's one other non-communicable disease, the diabetes. The most of the people in the Asian communities, they're 6 times more prone to the diabetes. So there's a lot of uncontrolled diabetes in the India because the people don't do the regular health checkups. And the most of the people, even they don't know they have the diabetes or not. So this concern is not basically they are unaware and they die earlier. They have basically the socioeconomic burden, which we are ignoring and then leading to a lot of challenges in the near future. So in international diabetes federations are estimating at this point that about 57% of diabetic patients they are in India, Nepal, Bangladesh, Sri Lanka, who are undiagnosed. Meaning by that they are creating a lot of other coronary diseases because of the diabetes. So diabetes basically it really supported other factors which is degradation, the quality of the life and the quality of contribution of the human, which ultimately cause on the socioeconomic burden. So the large majority of the diabetic patients discovered from the health complications and still they're untreated and ultimately they lead to the complication factors. Diabetes and the black fungus. In these days, I think this is one of the issues which we need to address across the South Asia. Ultimately, Middle East, because a lot of South Asian people, they visit Middle East. Because India and Pakistan, they are on the high state threat. While India have a lot of patients, about 140 cases per million annually, according to the leading international fungus evaluation. So basically leading to the diabetic complications. So the poorly controlled diabetes puts you to a high risk of certain infections. So we need to have the proper checkups across the nation so people cannot have some kind of complications which create new variants of the next pandemic like COVID-19. So the patient recovering from the COVID-19 is according to the recent research paper looking at the cases globally, 94% of those cases of the fungal infection is suffering from the diabetes. So it means the people who have the diabetes, the patient who has the diabetes, he is more prone to the fungal infection, which is one of the new complications, new variant found in the COVID-19. So two widely prescribed steroids, dexamethasone and methylprednisolone, are used for the COVID-19 patients in India to reduce the inflammation caused the body's immune response. So hospitals and doctors are overwhelmed by a growing number of cases. The evidence that these steroids are being taken without medical supervision. They don't understand this kind of situation, how dangerous for them. They are not taking the steroid therapies on the proper regime basis. So the Indian authorities recently warned such against cases, such kind of cases, which can be seriously harmful consequences, including they have the increased risk of developing mucormycosis. These kind of complications, they need the new variations in our populations. Unfortunately, in South Asia, most of the countries, they deprived and health professionals poor. Specifically in Afghanistan, they have only, when we are saying the patients, our doctors patient ratio appropriate is about 70 doctors need to be out of 10,000 doctors. And Afghanistan is one of the lowest, who has only 2.78 out of 10,000 doctors, data indicated in 2016. Pakistan, recent data showing 11.18 out of 10,000 doctors are available to service the nation. Bangladesh has 9.68 out of 10,000. Nepal has 8.09 out of 10,000. Bhutan 4.6. Sri Lanka 11.54. India 9.28. And Maldives is the only country who has the best number of professionals available to service out of 10,000 patients doctor ratio. So the World Health Organization defined what basically is the capacity we need to create. The capacity building which is required basically not based on only the knowledge, skill, and commitment structured system, but it needs a lot of leadership to enable such kind of effective health professions. So South Asia needs more trained health professionals. That's where we are requesting the South Asian categories and surgeons so they can strengthen their profession across the nation, across the region, to train more, integrate their experiences, to integrate the different research factories so that they can compile such kind of data to help this region to get out of this mess. So training through Islam, what we're talking about today, our core base is basically organization of Islamic countries. So we request the way Islam is saying. In Quran, 4.1 ayat is saying, oh, you who believe, take your precautions. This, we need to believe in that, and we just support as a Muslim or non-Muslim, we should have to put our hands together to serve this region, as the most of this population is covering Pakistan, specifically a base toward the Middle East to create a lot of engagement in the research and development to involve other countries, including the Middle East countries. So the national Muslims, like Corona cases, response committee in Guinea are using verses from Quran to encourage the COVID-19 prevention. So different countries, they are using different parameters to get involved, the Islamic movements to move forward. But my request in South Asia, we need to strengthen our Center of Excellence at South Asian chapter. Now, the major challenge in this region, the heart diseases in South Asia. South Asia accounts for a quarter of the world population. As a big number, we are focusing at this point and doing our talk. So yet it's already claimed about 60% of the global burden of heart diseases in South Asia. South Asians may also be at an increased risk of heart failure, and that it presents the earlier ages than in the most other Asian ethnic groups. So my humble request to this region, heart diseases basically is not leading only to the heart factory, it can create other pressures to the vital organs, including kidney, leading a lot of cascade process of the disease patterns, which basically we are at the threat. And when we're talking about in 2050, more than 500 million elder patients, meaning by that, not we have the heart failure, we have the other vital organ failure challenges to this region, creating a lot of socioeconomic threat of to handle this kind of situation. So the plague of the misinformation. In these days, I think this is one of the major issues to have in consideration. every day in the WhatsApp and the different, sittings, we found that we Google doctors. Everybody become a doctor while listening to things, looking at the different WhatsApp and sports. So please, my humble request is that we should have to stop the misinformation, learn and earn from WhatsApp or any Google information. We need to have the authenticity community who basically should have to work on WhatsApp areas, on the different Google things in South Asia. Because South Asia diseases have different challenges as compared to the Western world and North America world. So we need to focus on it. It can really disturb our socio-economic pattern by misleading the people with the wrong diagnosis. So according to the published by the Gallup Pakistan, 49% of the population is reluctant to get vaccinated even if the vaccine is offered free of cost. The reason again is the misinformation through the map, specifically WhatsApp areas or Facebooks. The experts say that the misinformation, the religious beliefs are responsible for people mistrust of the vaccines. So if we can have this misinformation stopping committee or the due diligence area who can focus on these things to encounter such kind of misinformation, I think we can help our less educated region to support the health sector. So the many people in the country believe the pandemic does not exist. Rumors are also rife that Western world want to insert a surveillance microchip in the human body through vaccine shots. It is unfortunately bad. A lot of professionals, but a lot of other world people like Americans and the Europeans, they talk such kind of misinformation. Please don't listen to them. That has no value. No doubt, this is our, one of the attack on the human life. Maybe happened many times before. It will go away. In my opinion, I have the different programs where indicated that we have to focus on the herd immunity. We will face this coronavirus anyway. We need to have precautionary measures. We need to have immunity, in sufficient immunity, and the belief structure not to be panic. So that is the area where we need to focus in supporting with the vaccine, because vaccine is one of the tools to help in this area. So please, misinformation, don't believe in misinformation. And my request is so they should have to focus on such kind of challenges by creating a committee who can work with the help of the experts. So fight against medical misinformation. In the UK, about 100 mosques have joined a campaign to encounter vaccine disinformation and pursued their communities to take the COVID-19 vaccine. They have said that they will use their Friday sermons to urge people to have that job. I think we need to have an application in South Asian religious places too. So stop the spread of information. We went to one of the slogans so people can remember that one. So use the South Asian Academy of Surgeons, the method to prevent the spread of misinformation. So SAPS, the South Asian Academy of Surgeons, they developed their name according to that. Just as a correlation, name actually is the South Asian Academy, but they say our South Asian Academies, S stops before forwarding a message. The Asian, the S is whether this information is correct or not. Then again, A leading the academy, accredited or approved with the information was gathered from the reputable sources. The P basically the physician, the purpose is this information serving a purpose and helping society. The surgeons as sent carefully when relevant. So we need to have steps to stop the spread of this misinformation, just the purpose of the memory. So the disease don't recognize borders. So the Delta variant, which is more transmissible and helped fuel a massive surge in India, has been detected in India immediately than in its neighbors. So my point is this: we need to consider our borders, not be worrious to spread such kind of the infections. We need to care for areas like Middle East. There's a lot of challenge in this area. So health and international concern is not basically health has no borders. Like in SAPS or South Asian region, the most of South Asian region people, they have jobs in Middle East. So if they carry any transferable infection, so automatically when they've been in that typical region in their latent period, they can transfer their infection to that typical area. So health has no borders. We need to focus all together. The Muslim world, not only the Muslim world in South Asia, at large from everyone, including Middle East, that 95% of the workers active in domestic and construction sector are migrant workers from South Asia. As of 2013, it was estimated that approximately 18 million legal migrants resided in the GCC region from South Asia. So we need to focus on Muslim League as a whole, not only South Asia region, because the borders we cannot stop. So we should have to promote the slogan of this health without borders. So what helps infrastructure? In rural Pakistan, investigators demonstrated that availability of high quality public care not only improved the management of the risk factors such as blood pressure, but also reduced mortality in the dramatic manners. So Pakistan, where I'm working at this moment, organizing a team of professionals to gather the data in the different chronic diseases, especially the lifestyle-related diseases. So our purpose is this: we need to focus why this blood pressure is. If we are saying the blood pressure in Pakistan with the people who are aged more than 50 years, their blood pressure, they carry everybody blood pressure almost after the age of 52. So my point, if we have gone the other way, such kind of threat, why not we focus earlier in their lifestyle to improve their lifestyle to avoid the causes behind that factor? The causes is the not right food, use of oil, specifically in the way we are cooking our foods. The oil cooking foods, basically there's a lot of promotion in the media. My advice, there must be a community who should focus on the cooking oil campaigns, on the media, and specifically the bakeries. I am really shocked. More bakeries are in Pakistan than anywhere in the world. So our government is really sleeping factor at this point. That India has a lot of bakeries. Why not our government is focusing on it? These bakeries, which kind of food they are providing, which create the health indicator on the positive direction. In my opinion as a professional, all bakeries, the food they are producing is mostly carrying the factor as some other negative impact on human life. So please, we need to have community in South Asia, the group of professionals who can work on this sector, how we can help the people to use the baking products and how to avoid the baking products. And why not we should have to request our government to discourage this industry and encourage the industry who can have the lifestyle-oriented things. So please, government should focus on it. Our team across the globe who are working in the YC sector, and the why Muslims are most who are really prone to the sweet. If we can see that the benefit of and the bad impact of the sweets, look at the China, look at the Korean countries, Japanese. I don't think you can find such kind of sweet, hunger. Why we are so much in sweet hunger? Why we are promoting? Why we are not discouraging? Most of the sweet out of these bakeries, they have one or the other bad impact to the human life. Either the gastrointestinal, cardiovascular, absorbable factors, digestion, immune system. So this basically is a bad impact to the South Asian region we need to address. Again, this can be possible if we have the reputable professionals who can create such kind of R&D work to give the solution to their local governments. I'm really appreciating all the participants and thank you very much for the ORC team who gave us such a giant chance. But again, my purpose is this possible? We can do such kind of challenge to help a team of professionals who can overcome these challenges to take all these factors which we are facing in this moment in the South Asian region, and we can have this work now to encounter the challenge of 2050 when we have the more than 500 million people who will be elderly and have a lot of challenges. It's just creating a lot of bad burden on the socioeconomic impact in this region. Thank you very much. I really appreciate it. Stay blessed.
Thank you very much, sir. We have some questions which were posted by the audience. So, first question is from Ms. Noor Jahan. She's asking, what is your comment on the info that the fasting blood sugar limit was decided to be decreased to help big pharma companies to distribute their products?
Okay, and the last sentence was said. Can you repeat it, please?
Yes.
That we did not be in the fasting blood group?
Yes. She's asking.
Fasting blood sugar.
So basically, she's asking was that they have decreased the limit of fasting blood sugar so that the big farmers, or presumptively speaking, so that big farmers can sell their own products.
Yes, right, okay. This basically is a lot of Google doctors, information is available. So I think she's right. The blood sugar, if I say such kind of things, a lot of the professional will be upset. She is right. We should not get panic. The blood sugar must be less than 120. Even up to 140 is fine. We need to focus on the lifestyle, not to take medications. I treat my patients all the time. I reverse the diabetes on the spectrum. Sometimes the people, they have a transfer factoring of diabetes. And when we go to the doctors, they recommend, okay, take this anti-diabetic medications and we continue to use like we use the food. My concern to the professionals, I request to them and to the patients, they must focus on their concern. What are the factors behind a change came in their body to have the sugar level raised as compared to before. They must focus on their lifestyle. They must focus on their health concerns. Because sometimes other diseases, they have this impact of less work on the pancreas. So they should not immediately go on the medication. They must focus on their lifestyle to encounter such kind of problem. If there is a damage happened, then we need to have continuous medications. The most of the patients, in my opinion, if they adjust their lifestyle, they recover.
Right. Thank you. So we have another question from Ms. Saida Maira. She's saying it's not just in Pakistan or Asia. Many other countries like Ireland and Sweden didn't believe in COVID-19 and show no positive attitude towards precaution. So I think she wants to have a comment on that. Why the phenomena of considering COVID-19 as something that is insignificant, common in other parts of the world as well.
She's right. I think the people are right. I don't blame them. Like hundreds of years before, many times this situation happened, this kind of pandemic situation was created or happened or God knows better. There's a lot of conspiracy theories are going on, but we need to agree on this now. This factor, the coronavirus is there. I don't think so. We need to get panic. I agreed on that part, but I don't want the people should not be responsible to encounter and to work out in such kind of situation. So you guys should have to work just against the virus, not with the phenomenon.
Thank you. There is another question from Ms. Farhad Ashraf. She's saying, what you suggest about population-based vaccination? I mean, vaccines should be population-specific because of the genetic diversity.
Agreed on that part, but unfortunately, the vaccine needs a lot of time to have the right, research and right data behind the vaccine. We are in a phase where we cannot, save the time to cover such kind of R&D work. So whatsoever we have, we need to focus on it.
Right. So they are saying that some vaccines have been banned and some medication regarding this COVID-19. But Pakistan is still using them without much care, and some people didn't show any worse effect of these medications. So how is this? I mean, I think she's asking for a general comment that we are seeing a trend that countries are becoming particular about the kind of vaccine that they want their citizens or people coming to their country to have. Like UAE not accepting vaccines from particular vaccines from China. I mean, so what is your comment?
So I don't want to go on that typical politics. It can't be politics, I can tell. But in my opinion, where I have a lot of R&D work, regional factoring to cover the disease are more appropriate. Chinese vaccine, in my opinion, is not bad because the regional, it covers the regional genetic. If we have the benefit out of the Chinese vaccine, we should not say no. But if there is a politics, this country's vaccine is, we don't want to accept because some political reasons, I don't have any answer for that.
So I think there's also sort of a general question which is saying that like dexamethasone is being used so much in our hospitals, isn't it fatal?
Steroids are okay. It is important to use in corona patients, but abuse of such kind of medicine is not good. My humble request is that patients should not take steroids with themselves. They must take under supervision of doctor.
So I think these are all questions that we have. Thank you very much, sir, for coming and for your valuable time and delivering a fantastic talk. And with this, Dr. Hanar, do you have anything to say?
Nothing but just thanks to sir for sparing his precious time for this exciting lecture. Thank you so much, sir. Very much appreciated. And I was looking at the participation. It's almost house full. More than 90% here, and we have many on YouTube channel as well. So very much appreciated. Thank you so much.
Okay. Thank you very much, and we thank all our participants as well. Thank you, and with this, we close this session. Thank you very much. Bye bye.